And we're good.
Okay, good morning, Napa County. We're here with Dr. Karen Reluccio, Napa County Public Health Officer, this morning for a COVID-19 briefing. It's no secret we're in the midst of a COVID-19 surge, largely driven by the Delta variant, and there are a lot of updates we have for the community this morning. So Dr. Reluccio is going to provide us with a few updates, including the big one that effective last night at midnight, Napa County joined a number of other counties in issuing a masking order. So Dr. Reluccio will talk about some of the healthcare impacts that led to that order, and also provide us with some updates on the state vaccination mandate for some high-risk workplace settings, as well as schools reopening. We're watching your questions in the comments, so feel free to drop them in. At about 9:30, we're going to switch over to a Spanish language session, but we'll try to get to as many questions as we can. So with that, I will turn to Dr. Reluccio.
Hi, good morning, everyone. I want to talk about the masking mandate that got issued at 12:01 a.m. Effective today. This is not a decision that I take lightly. Traditionally, we have gone along with state orders, but we are in a situation where our healthcare system is in big trouble. With the rise in cases that we've seen, even among unvaccinated and vaccinated people, it is hitting our healthcare system hard to the point where they're requesting additional resources from the state. I am going to talk about first the healthcare impacts that we're seeing and the hospitalization trends. And it seems like there's a lot of there's a lot of issues that are contributing to the increased hospitalizations. There's COVID, but there's also the impacts of delayed medical care that resulted from the shutdowns earlier, and then just the fear of going into to the doctor's office due to risk of COVID. So Jesus, I will have, if you could share the slides, and then I will talk about that briefly. And then I'll also talk about the Delta variant. So, what we're seeing in the month of July is just that the number of new admissions, which, only just shows new admissions. It doesn't show how many accumulate within a hospital. We've gotten to 4 new hospital admissions per day on average. And this is cumulative. So there's varying numbers of days that people stay. And it tends to be that people with COVID-19 tend to stay longer. And if you go to the next slide, this is the number of hospitalized patients that are COVID positive. So it's increasing. And, the percentage right now is nearly 10%. And that does have an impact because it requires more nurses to take care of these patients, especially if they go into critical condition. And then next slide. And this is the number of adult ICU patients that are COVID positive. So, sick, some ICUs only have 6 beds. So if you're talking about like most of them being COVID patients, that already has a negative impact. So what does that mean? If somebody has a stroke, or if somebody has a heart attack, which is another reason to be in the intensive care unit, then it compromises staffing, and ICU patients require intense nursing staffing in order to make sure that they get the care that they need. They're going to have high needs, they're unstable. And now with the impacts of COVID-19 and seeing some ICU admissions, it is also really negatively impacting our hospitals. You can take down the slides. Thank you. The one thing I want to talk about is the Delta variant. So the Delta variant now makes up more than 85% of the circulating strains in California. And it happened really fast. So in the beginning of July, it was like around 58%, and it shot up to 85% within that week. The reason why we're concerned about the Delta variant is that it's a lot more infectious. So if we talk about the regular COVID virus, COVID-19, if you have one infection, it leads a person with COVID-19 can infect anywhere from 2.5 to 3.5 people. And that's that's the reproductive rate. With the Delta variant, it is double that. So it's just as infectious as chickenpox. The most infectious virus that has the highest reproductive rate is measles, where they call it R naught is 12. So that's the most infectious. So this is falling. It's definitely more infectious than what we've seen with the original COVID-19. And then the other thing is that there are vaccinated people that get infected with Delta that are actually transmitting it. And they might have very minimal symptoms or be unaware that they are infected. I think that's also contributing to the increased cases. And then one more thing is that the people that are getting infected with Delta that are unvaccinated are more likely to have a more severe disease, and they're at higher risk of death. So I think that the one thing that's important is vaccines are still it's still important, because we know for sure that it will prevent hospitalizations and deaths. And the reason why we're going with a mask mandate is because we're seeing both cases in vaccinated individuals and unvaccinated individuals, with the majority being in unvaccinated individuals. Let's see. And then so anyway, I'm just wondering if you have any questions, Leah, or anyone, any other things that we should be just discussing. Should we pause?
Let's maybe let folks know that our mask mandate, the order text is available on our website, along with a lot of other guidance. We know that there's a lot of information that people are processing right now. This surge has thrown us all for a loop, and it's not that our science is changing, but our virus has changed, and that is what viruses do, and we're trying to stay ahead of it. This Delta variant is very contagious, and this is a race that becomes increasingly hard to win without measures like mask mandates. Is there anything else you want to say about some of the data and the resources people can find on the website if they have questions or looking for more clarification?
Yeah, I mean, I could talk about, I think the other thing that is really important with this is that it's a combination of vaccination and masking that is going to help us get through this pandemic. I think that there's the impacts are really big. So I think that that's where we want to make sure that, we protect our healthcare system, because, if you have heart disease, you need surgery, you want to be able to go to the hospital to have that. If your family member, gets pneumonia, you want to have the capacity to take your family member to the hospital without having them transferred out of the county or even out of the region. This is not just based on case rates alone. This is based on hospital impacts.
Absolutely. And we're getting a few questions from people who want to know what the data says itself online. So we have a question on Facebook about how many hospitalized people have been vaccinated. In other words, how many hospitalizations or breakthrough cases. We have some of that outlined on our data dashboard, which is available on the website. It's the big blue button. We have another question about, I'm a senior with underlying medical issues. How concerned do I need to be about the severity of illness if I catch COVID? And this is someone who's fully vaccinated. So they're asking about underlying issues, severity of illness when they're fully vaccinated.
Yeah, so, people that have weakened immune systems or underlying medical conditions, even if you're vaccinated, there is still a risk you can get infected. We have had, we've had 4 deaths in people that had underlying medical issues and weakened immune systems that succumbed to COVID-19 despite vaccination. So, but that's only, I think that's 4 out of 84 deaths. So, I think that we know that the vaccination does decrease the risk of severity illness, but if you're at risk, you should, continue to practice the measures to protect yourself, including, indoor masking and, maintain social distancing. Even though the economy is open, people that are at risk should take those extra measures.
Thank you, Dr. Lucia. We have a question about schools. We know all 28 schools in Napa and American Canyon are scheduled to reopen in a couple weeks for on-campus learning. This is a largely unvaccinated population of school-age kids, so we want to be especially cautious about this reopening. What can you tell us about the masking requirement that's in effect for students and teachers and other measures?
Yeah, so, according to state guidance, all teachers and students should be wearing masks regardless of vaccination status. Additionally, schools are going to reopen fully. So there is not going to be social distancing. So you're using other measures such as vaccination of eligible individuals, masking, ventilation, and of course, symptom screening and the sanitation to just ensure that there isn't spread of COVID-19. I think the overriding goal is to make sure that we can keep kids in school because, the impacts of the pandemic and distance learning has had a negative impact on academic achievement and socio-emotional development. At this point, it's such a high priority to have kids in school that despite the Delta variant, the other measures are going to need to be used in order to prevent spread.
We know that's so important to take measures like this right now, especially when we're in the midst of a surge to protect our healthcare system, but also to make sure these kids can get back to some semblance of normal life and normal educational experience. So sometimes that does require us to make sacrifices and throw our masks back on. We know vaccination is our most important and effective tool, as you're saying. There are some folks out there who are maybe still on the fence about getting vaccinated. Why is this the most critical time if you're unvaccinated for you to move forward and make that decision, talk to friends and family who are unvaccinated?
Yeah, I mean, at this time, the way that we can slow down the spread of the Delta variant is to increase the percentage of people within our county that are vaccinated. At this point, 75% of our county is vaccinated, is fully vaccinated, and 80% is partially vaccinated. So we're heading in the right direction. But I think it's not just about, whether it's not just about you, you're protecting others. I think that we've made, tremendous progress in our campaign. We're trying to make vaccines more readily available and available in the community. And I think it's to protect our community, our people that are unable to be vaccinated because of legitimate medical issues or those that are not eligible for vaccination, such as our kids who are going to be back in school. It's also just to be able to have, to continue to keep our economy open as well, because, economic health actually really plays a role in overall health.
And several months ago, we had really limited vaccination supplies, and now there's probably never been a more plentiful opportunities to go get vaccinated. You can do it at a grocery store, at a pharmacy. There are a number of community vaccinators. Do you want to talk about some of the clinics that are happening across Napa this month?
Yeah, so public health is doing some vaccinations at school sites. You should have heard from the school districts about where these are. Ole Health continues to do vaccinations every Tuesday from 4 to 7 p.m. at their South Campus and 300 Cardinal Court. You could get a shot at scoring tickets to Bottle Rock. And then there's St. Helena Hospital Foundation is doing a lot of vaccination throughout the community. They've been one of our biggest vaccinators in the county. And then there's a whole panoply of pharmacies and grocery stores that have a pharmacy that also have plenty of vaccinations. So we're not short of vaccines.
Great. And do you want to give an update on the state vaccination mandate around high-risk settings that's applicable to workers in high-risk settings? Can you sort of explain that order to us, who it applies to, when it might take effect, when it will take effect?
Yes, so this actually takes effect on August 8th. So there's a state health officer order from the state health officer that mandates vaccination of healthcare workers in acute care settings, long-term care facilities. There's a whole list, and it's also senior care centers. So this is available in the covid19.ca.gov. There should be an order there. What has to happen is that you have to show proof of vaccination, first of all, and that's either by a vaccination card, a picture of a vaccination card, or a photocopy, a note from your doctor, or else for those that are registered to get their smart QR code from the state vaccine database, that is also proof of vaccination. So they're required to do that. And then for those that are unvaccinated, they either have to get testing once a week or even twice a week. In addition, by September 30th, all healthcare workers in those settings will be required to have at least one dose of a 2-dose vaccine or their single dose Johnson & Johnson vaccine by September 30th. Or else they just keep getting tested. So this is a mandate, and it has come from the state health officer.
Getting a few comments on Facebook. People are really interested in booster shots and the idea of getting a third shot. This is something we're hearing about in other countries. Is there any update on public health guidance here in this country around the idea of a booster shot?
Yeah, at this time, the official bodies that advise on this, which is the Food and Drug Administration and the CDC's Advisory Committee on Immunization Practices, is not recommending boosters at this time. They are still evaluating the data just to see which populations will need boosters. This is, we follow the ACIP guidance, and up until the time that they change that guidance, boosters are not available. At least they're not. We're beholden to the guidance that they provide.
Great, and it looks like folks are also interested in any news about vaccination approval for kids under the age of 12. Any updates on that?
Yeah, I've heard that it's going to be later in the fall, or possibly before the end of the calendar year. I think so. That's where I've heard it. It keeps changing. I'm hoping it's sooner rather than later.
Okay, Dr. Reluccio, I think we're getting close to the beginning of the Spanish session here, so I think we're going to wrap up. If folks have additional questions or comments, we're going to drop the link to our website in there that has all of our official resources and links to state guidance. We're monitoring the coronavirus at County of Napa inbox if folks have additional questions. And Dr. Reluccio, any closing comments or thoughts?
Yeah, I think it's going to be really important to get vaccinated. I think you're protecting yourself and preventing hospitalizations and deaths. You're protecting other people that can't get vaccinated. We can't drive that home enough. And at this point, also because we have to protect our healthcare system. It would be a really terrible thing to have to go to the hospital and have to be transferred to another hospital because they're full. So this is really for the greater good, as frustrating as it is to some.
Okay, well, thank you so much, Dr. Reluccio, for joining us during this busy time and providing this important information. And thank you to the public for joining us. We appreciate everyone who's out there taking action to keep the community safe, masking up, keeping your chin up. Please share this information with friends and family. We know this order came out last night and went into effect at midnight. We want to make sure folks understand it and understand how to protect the stability of our healthcare system amidst this unexpected and truly unwanted surge. So stay safe, everybody. Thank you.
Thank you.